Hello, Dr. Simone here. Welcome back to my channel, Dr. Simone Says. Today's video is going to be a webinar and I'll be dealing with diabetic foot care. And a lot of the information I'll be sharing can actually go for people who are not diabetic. My goal for all of my patients is definitely 2 feet, 10 toes. Now, if you don't come in with 2 feet and 10 toes, I can't give it to you, but I will do everything I can to work with you to keep your limbs on your body. So once again, this is a webinar. If you're not diabetic, it's still going to be helpful. And if you are diabetic or if you know someone, a mother, a brother, or a sister, a father, then definitely share this video with them. Tell everybody you know, because this information can actually save limbs and ultimately save lives. So a little bit about me. I was born in Ohio, but I spent most of my childhood in Jamaica. After I graduated from high school in Jamaica, I went to the University of Dayton and I received a biology degree, Spanish degree, and then a chemistry minor. From Dayton, I went to Miami, Florida, where I went to Barry University and did my podiatric medical degree. And I also received a master's of public health at the same time. And then after that, I went to University of Pittsburgh Medical Center. And in Pittsburgh, I met my wonderful husband. And then I also completed a 3-year surgical residency for podiatry. And then since about 2006, I've actually started a company, or I founded Esteem Motivational Speaking. So I've actually been doing medical lectures as well as motivational, inspirational lectures for almost about 10 years now. But I definitely made it official, like I said, in 2006 with my speaking company. Okay, so let's talk about diabetes, and I will try not to go into too much detail about specifics. I'll try and give you just a lot of the good, meat and potatoes information. But basically, diabetes is actually a group of diseases, and the underlying problem is that there's just too much sugar in the blood, and that's called hyperglycemia. And because of this excess sugar, it can actually lead to multiple damage or multiple organs becoming damaged, such as the eyes, the kidney, the blood vessels, the nerves. As a diabetic, or if you know someone who's a diabetic, you probably hear a lot of terminology such as diabetic or pre-diabetic, or someone who's diet controlled. And all that means is that if one does not monitor the amount of sugar that they take in or the amount of certain starches that they take in, then they can definitely become a full-blown diabetic. Some diabetics are on insulin and their body requires that to function properly. And then others are not on insulin, but they're on medications such as glyburide or metformin. And then someone might be termed a type 1 diabetic or type 2 diabetic. And there are some new terminologies that have actually been used recently, but these are just the basic ones that most people will hear when dealing with diabetes. So I won't bore you with the statistics. If you're interested, definitely diabetes.org has a ton of information. But the importance of this slide and the next slide is basically just to show that the prevalence of diagnosed as well as undiagnosed diabetics is definitely on the rise. So it's something that we need to be very mindful of. It's not just a problem with too much sugar. People think, how can sugar be bad? Well, there are many things that diabetes can affect, and so too much sugar is actually not a good thing. So once again, like I said, I won't bore you with the statistics, but in 2010, diabetes was actually the 7th leading cause of death in the United States. So it's something that we should take seriously. So when it comes to foot care, diabetes can affect multiple organs, and of specific note, obviously, is the skin, the blood flow or the circulation, the nerves and muscles and bones. Now, we have skin everywhere because the skin is the largest organ in the body. And we have blood flow everywhere. We have blood vessels everywhere, nerves and muscles and bones. So even though I'm only talking about foot care, a lot of this information, can also be translated to other parts of the body simply because diabetes is a multi-organ disease. So lots of patients come in and the first thing they tell me is, Doc, I have dry skin. I've tried everything. I've tried creams, lotions, Vaseline, baby oil, what have you, and still my feet are dry. My heels are cracking. My nails are thick and dark. And a lot of it has to do with the fact that diabetes can affect the autonomic nervous system, which is the one that is responsible for moisture control in the skin. So I like to let people know it's not that you're doing something wrong. It's more so that the disease process is doing what it does. And sometimes it makes the skin too dry. So there are some medications, creams, and lotions that your podiatrist or your primary care doctor can recommend. So definitely ask them about that, because it's not you doing something wrong. It can definitely be because of your diabetes. But the problem is that when the skin is compromised, the skin is the barrier we have for our body. When the skin is compromised, then there's an increased risk for bacterial as well as fungal infections. When it comes to circulation or blood flow, podiatrists and other doctors, we definitely want to make sure that there are pulses. We feel and check for pulses and capillary refill time. A good thing that you should look out for as a diabetic or someone who knows a diabetic is there trouble with healing cuts or scrapes? Are the feet painful or the legs painful and cramping when they're elevated? Or let's say, for instance, you tend to have cold feet all the time. Or even worse, if you realize that there's a certain distance that you can walk, say you can only walk down one aisle in the grocery store before your legs start to get painful and aching. Those are all signs of serious blood flow issues, and you should definitely let your foot doctor know about that. And of course, if you don't have any blood, then there's going to be a problem with healing, because wounds and cuts and scrapes and ulcers, they all need blood to heal. And blood helps to preserve the skin and keep it healthy and intact. So if the skin gets thin, then it will break down, and then there's an increased risk for infection. So blood flow has a lot to do with the health of feet in general, especially for diabetics. Nerves and muscles, like I said before, are definitely affected. Most people come in complaining of tingling, burning, numbness, feeling like ants are crawling on the skin, or the foot has sharp shooting pains, or maybe they're not able to sense hot versus cold. These are all signs of nerve damage that can most definitely be linked to diabetes. Another problem too is a problem with strength and motion, and what we call proprioception, or the ability to detect where your foot is or where your body is in like a 3D space. So sometimes balance is affected by diabetes, as well as contracture of muscles and deformities. So what happens is, if you look at the picture on the left, you'll see a picture of normal toes, and then below you'll see hammer toes or contracted toes. The problem is what we call like an intrinsic minus foot or a diabetic foot. The nerves and muscles aren't working the way they're supposed to, and that causes a muscle imbalance, and that imbalance actually creates deformities that can rub and create friction in the shoes, and that can cause sores and ulcers and make the skin break down. So what should you be doing in general? Or what should you tell your aunt to do in general? First thing is, check your feet every day. You can't skip even one day. I've had patients who say, oh, I haven't looked at my feet in a couple weeks, and then I took off, or then I decided to take a look at my feet, and now I have this hole there. Well, the only problem with that is, like I said, minutes and seconds and hours count when it comes to diabetic foot ulcers, sores, or infections. And so now he comes in and he hasn't really looked at his feet in a couple of weeks. I mean, he's showered and such, but he hasn't looked at his feet. And now he has a rip-roaring infection with an ulcer. And I've had to take people to the operating room same day for issues like that. So checking your feet every day, you're looking for sores, bumps, bruises, foreign bodies, anything that was not there the day before. You want to make note of it. If it is an emergency, go to the emergency room or call your foot doctor. Don't sit there and wait and hope it gets better. If you have like a foreign body, like a paper clip or a thumbtack in your foot, then definitely pull it out. But as soon as you can, you want to make sure you get to the emergency room or to your doctor's office, because you want to make sure your tetanus shots are up to date, and you don't want to miss something that could potentially cause a bad infection or even an amputation. And then the second thing is checking your shoes before you put them on. People say, well, what am I checking my shoes for? They're diabetic shoes. Well, shoes can have paper clips or nails in the bottom of the shoe that can rub and cause a sore on the sole of the foot. Even, pet toys or baby toys. Everybody, has grandchildren, and they put toys into shoes, and you don't know, and you stick your foot in there, and now you have a sore that you didn't have before. So before you put your shoes on, give them a good shake. Make sure there's nothing in there that could potentially be harmful for you. Obviously, you always want to wear shoes, even around the house. A lot of times people say, oh, I don't go barefoot. What they're really saying is that they wear socks around the house, but socks do not count. I usually tell people, if you're not going to have your diabetic shoes on at home, you need a house shoe with a rubber sole. Washing and drying feet well is extremely important. Pay attention to the web spaces. A lot of times people don't really wash between the toes, and then debris gets caught in their sock lint. And what that does is, with all that moisture and the debris, it can cause the skin to break down. And if the skin breaks down, it can get a fungal infection, or worse, a bacterial infection. And unfortunately, I've actually had to do partial amputations because, in particular, I had a patient, very sweet lady. She was a diabetic. She was under somewhat good control with her blood sugars. But when she presented to me, she had a bacterial infection that was secondary to a fungal infection, and the bone at that point was infected. But it really all started from a web space infection because she had too much moisture and debris between the toes. So when you're washing and drying your feet well, you want to pay attention to the web spaces. Number 5 is important, and this goes for anybody. Use lotion and cream every day, yes, but don't go between the toes. Don't go between the toes. Lotion and cream between the toes increases the moisture, and moisture increases the possibility of a skin breakdown, and that can lead to ulcers, sores, infections, and sometimes amputation. So the goal, like I said, is 2 feet, 10 toes. Some diabetics complain of cold feet at night. You can definitely wear loose-fitting socks to bed. That can help out. And then number 8 is important. You want to follow up regularly with your podiatrist. There are things that we are going to see and diagnoses that we are going to make that you might not pick up on your own. So being seen regularly is extremely important when it comes to the team effort to help your feet remain healthy. Don't. Okay, so what should you not do? Don't perform bathroom surgeries. People say, Doc, what is a bathroom surgery? A bathroom surgery is when someone has a callus, a corn, and or a sore, and they go out into their kitchen, they take some alcohol and a cutting knife, and they go to cutting away the callus. Or they take a machete or a pocket knife from the shed and cut away the callus or a sore. And you, at this point, you're probably thinking, no, that would never happen. Yes, it has happened. I've seen people who come into the office with big sores on their foot. I say, what happened? Oh, I had a callus. I thought I would cut it off. And now they have a rip-roaring infection, and we're in the operating room. So no bathroom surgeries. If you do have an object that is stuck in your foot, yes, take it out. But go to the emergency room, make sure your tetanus shot's up to date, call your foot doctor, get seen immediately. You don't want to wait and see what happens the next day, okay? So no bathroom surgeries. Another thing too is if you do notice that you have a bruise or that you're bleeding, then you need to let someone be aware of it. I would prefer, this is what I tell all my patients, I would prefer you come and see me and me tell you, oh, that's nothing. Don't worry about it. Then you make that decision and be wrong. Okay? So no bathroom surgeries, and if you see something that doesn't look right, bring it to my attention or bring it to your foot doctor's attention immediately. Okay? Let's see. Number 2, don't soak your feet. A lot of times people think, you can put Epsom salt soaks for everything. Not necessarily. Once again, too much moisture can lead to skin breakdown. Breakdown leads to infection. Infection can lead to amputation. Number 3 is very interesting. I've had a lot of patients who actually come in wearing 3, 4, 5, 6 pairs of socks at a time. And their reason is because the shoe feels too big, or they feel like they need more cushion or support, or whatever their reason is, they're wearing multiple pairs of socks at a time. And a lot of times the problem is that their nerves aren't working properly, right? So the sensation is decreased. So they feel as though the shoes don't fit properly, but really the shoe fits properly, and now they have made it too tight and they've created sores or friction or blisters. So 1 pair of sock at a time. Of course, you want to Wash your socks before you wear them again. This seems like something that should be straightforward, but just a friendly reminder. You don't want to put old socks on after you've washed your feet and dried them well, because there can be bacteria and fungus, that's still lingering around. Plus, just dead tissue and dead skin cells. You don't need to be representing that to your feet. And then number 5 is universal. Don't smoke. What does smoking do? Smoking literally makes the blood flow less. I think there was an article a few years ago. It might have been updated since, but I think they found that nicotine decreases blood flow in the vessels by like 16 times or something. So regardless, everybody knows you should not be smoking. But if you are diabetic, every time you inhale that cigarette smoke, you are decreasing your risk for amputations. So some of the risk factors that you might hear some of your loved ones talking about, or that you yourself might be dealing with, some of the risk factors when it comes to your feet and diabetes: numbness, or absent feeling to your feet, long, thick, hard to cut toenails, hammer toes, bunions, or even any other type of deformities to the feet, calluses, balance issues, difficulty finding shoes that seem to fit well, or if you have cuts on the skin that take a long time to heal, or if you have pain to your legs when you're walking, or if they're elevated. All of those are serious risk factors that need to be addressed. So it's a lot of information, and I like giving people easy, tangible things to work with and to remember. So there are 3 daily habits that I tell my patients to follow, and this will definitely help to prevent foot problems. Remember to team effort, getting your nutritionist, your diabetologist, your primary care doctor, your foot doctor, and if everybody has to be involved, as well as you, in your foot care. So there are 3 daily habits I try and tell people that can help prevent foot problems. The first one is look. Doc, what's am I looking for? Remember, you're looking for bruises, calluses, bumps, lumps, infection, anything that was not there the day before. You need to bring it to someone's attention. And sometimes people say, I can't see the bottom of my foot. No problem. Most of us can't bend our foot up that high anymore, but that's okay. What you can do is you can put a small mirror on the ground and just have a seat and hold your foot over the mirror. And then you'll be able to see the bottom of your foot. Or if you have a mirror that stands up, get a chair, sit down in front of the mirror, and just hold your foot up so that you can look at the bottom. So there are ways to get around not being able to be as flexible as you were before. So no excuses. Another thing too is, suppose you don't have good eyesight. Well, if the feeling in your hands are still fair to good, then do that. When you're putting on your lotion, take a good survey of your feet. Feel around. Does something feel odd? Is there a new bump, lump, cut, bruise? Is there moisture that should not be there? And then finally, ask a friend. There are church members who will be more than willing to come by and just help you check your feet, or they might see you in church and say, hey, let's step to the back and, let me take a look at your feet. So always look at your feet. I would prefer daily. And then, of course, if you have other issues, as often as possible, but daily look at your feet. So looking. Listen. What am I listening to? You are listening to your foot doctor, okay? And all your doctors, actually. A lot of times people say, oh, you want to see me back in 2 months? Really? I wasn't sure if it was really needed because I'm not having any pain. The problem with that is that some diabetics aren't going to have pain until there is a problem. So you want to keep your follow-up appointments because we make those appointments with you for a reason. We're trying to keep 2 feet, 10 toes on your body. So listen to your foot doctor. If you're told not to get a pedicure, don't find yourself in somebody's pedicure seat, okay? And then finally, you're going to listen to your body. Foot pain is not normal. Foot pain is not normal. If you wake up one morning and you have foot pain and you have not had foot pain for 3-4 months, there's a problem. So listen to your body, because it could be telling you something that is going on, and the longer you wait to address it is actually the worse it can become. And then, of course, tell. Who are you telling? You're telling a friend. Say, hey, something's going on with my foot. Can you drive me to the doctor's office? You're telling your foot doctor, hey, I have these questions or concerns. Something doesn't look right. What should I do? You're telling your primary care doctor, you know what? I'm having a rough time keeping my blood sugars under control, or I'm having a hard time keeping my skin moisturized. What should I do? Look, listen, and tell. Really simple. All right. So look, listen, and tell. That brings us to the conclusion of this diabetic foot care webinar. I really hope you enjoyed it, and I'm hoping that it was educational, informational for you. Share it with your loved ones. Like I said, this information has the potential to save limbs as well as lives. So if you haven't already, definitely subscribe, comment, and like. And I will see you in videos. You can find me at my channel, Dr. Simone Says. I have other videos going up, motivational, inspirational, lifestyle things. So a lot of good things in the works. So stay tuned, and I thank you so much for checking in with me. Have a wonderful and amazing day.